Hello everyone, I am Dr. Vishwanath Gella. I am a pulmonologist. I bring to you warm greetings from the Department of Pulmonology at AIG Hospitals in Hyderabad, and I thank the Indian Women Network of CII, that is Confederation of Indian Industries, for giving me this opportunity to share my thoughts and views all over the world. March 24th is recognized and commemorated as World Tuberculosis Day. So this day is used in raising the awareness regarding lot of consequences because of tuberculosis. This is the day in 1882 on which Dr. Robert Koch has declared to the world that he has discovered the bacteria that causes tuberculosis, and later on this bacterium was named as Mycobacterium tuberculosis. It has been 138 years since the discovery of this bacteria, Mycobacterium tuberculosis, which causes tuberculosis. We have made a lot of progress in terms of diagnosing and treating tuberculosis. However, a lot of challenges remain because of emergence of drug-resistant tuberculosis and the HIV epidemic. Every day, 30,000 people fall sick because of tuberculosis. Out of these, 4,000 people die because of tuberculosis. In 2018, it has been estimated that 10 million people developed tuberculosis, and out of this 1.5 million people died, and it has been estimated that 58 million people's lives have been saved because of control efforts from both World Health Organization and different countries' health departments. In 2018, the countries and the whole world have made a great progress in controlling the tuberculosis. In 2018, the number of cases treated was 7 million compared to 6 million people who were treated in 2016, and a significant number of deaths have declined due to tuberculosis in 2018. India is the highest TB burden country in the world, and a quarter of tuberculosis cases are present in India, and a quarter of drug resistant cases are present in India. And added to this huge burden of active diseases, a quarter of the world's population is infected with tuberculosis latently. Latent infection means a person is infected with tuberculous bacteria. The tuberculous bacteria is present within the body. However, he does not have any active symptoms or signs. This is called as a latent tuberculosis. When a person's immunity goes down because of any reason, this latent tuberculosis can get activated and the person can develop active disease due to tuberculosis. To accelerate the TB control goal, the United Nations has convened a high-level meeting in September 2018 where all the heads from the different countries have participated and given their aims and objectives to eliminate tuberculosis in their own countries. This year's theme of World Tuberculosis Day is "It's time to end tuberculosis," and India has taken a target for elimination of tuberculosis by 2025, 5 years ahead of the world target of 2030 for elimination of tuberculosis. So in India, we can achieve this goal by 2025 by raising the awareness among the people at local, state and the national level. Given the seriousness of the problem, it is imperative for each of us to understand the facts related to tuberculosis. Let us see first how the Mycobacterium tuberculosis infects the person. Mycobacterium tuberculosis is a bacteria which causes tuberculosis, as we all know. When a person coughs or sneezes, the bacteria is released into the environment from a patient, and this bacteria is inhaled by person who are present in the surroundings. And when person breathes this tuberculous bacteria, the bacteria goes into the lungs, and most often our body's own immune mechanisms or a resistance power takes over the bacteria and tries to contain the bacteria, and the person develops what is called as a latent infection without any active signs or symptoms. However, when a person develops low immunity or loses its resistance power due to any reason, the bacteria multiplies within a person and leads to active symptoms and signs. Now let us understand why a person's immunity goes low. If a person is not eating well, or if a person has developed an uncontrolled diabetes or HIV, or if a person is on steroids or immunosuppressive drugs, or if a person is addicted to smoking or alcohol, the immunity goes low, and then tuberculosis can get activated within the body, and then it can lead to active symptoms and signs. Tuberculosis can predominantly affect the lungs. This is called as pulmonary tuberculosis. When it affects the organs other than the lungs, it is called as extrapulmonary tuberculosis. Extrapulmonary tuberculosis mainly affects the lymph nodes. These lymph nodes can appear in the neck or in the chest or in the abdomen. In addition to these lymph nodes, sometimes the brain and the central nervous system can be affected, or the heart can be affected, or the gastrointestinal system or the digestive system can be affected, or the genitourinary tract can be affected. Depending upon which part of the body is affected, the symptoms can vary. If a person has pulmonary tuberculosis, the person can have cough, phlegm, unexplained weight loss, fever, and his appetite will be reduced, and he can have sometimes blood when he coughs out. These are the symptoms of pulmonary tuberculosis. However, if a person has extrapulmonary tuberculosis, the symptoms and signs will depend upon which organ is affected. Suppose if a person is having a lymph node involvement, then a person can have enlargement of the lymph nodes within the neck or the chest or the abdomen, and this can lead to again fever or a swelling in the neck or swelling in the chest region, and they can have weight loss or loss of appetite, as I have mentioned. Suppose if a person has a involvement of central nervous system, he can have headaches, vomitings, and then he can develop a coma-like situation, and sometimes if it is affecting spinal cord or the nerves, a part of the body can be paralyzed. And if a person has involvement of the heart, so a person can develop a heart failure or arrhythmias, that is abnormal rhythm of the heart. If a person has involvement of the digestive system, the person can have abdominal pain, abdominal distension, intestinal obstruction, in addition to the fever and loss of appetite and loss of weight. Sometimes this bacteria can affect genitourinary tract, that is the kidneys or the ureters, and that can lead to obstruction at the level of the kidneys or the ureter level, which can lead to decreased urine output or kidney failure. So now, what are the modalities which we have to diagnose tuberculosis? So if it is pulmonary tuberculosis, we can get a sputum examination. If a person has cough and sputum more than 2 weeks duration, tuberculosis should be suspected, and the sputum should be subjected to tuberculosis testing. There are a lot of tests which are available these days. These days we have rapid diagnostic tests which are called as Gene Expert or the TrueNat, which are the molecular test which can diagnose tuberculosis very rapidly within few hours time, and at the same time give us resistance, whether the bacteria is resistant or sensitive to different drugs. If a person's sputum is negative for tuberculosis, and if you are strongly suspecting tuberculosis, then you can do technique like bronchoscopy, where you can go into the lungs and then collect the sample and subject for test. And there are a lot of other newer technologies called as endobronchial ultrasound or medical thoracoscopy to diagnose extrapulmonary tuberculosis cases. So depending upon which organ is involved, the sample can be like a fluid which is taken from the abdomen, or the urine, or the CSF fluid, that is the sample which is taken from the brain. All these samples can be subjected to tuberculosis testing, and you can make a diagnosis. And now, what are the treatment options for tuberculosis? So if a person is having tuberculosis with drug sensitive organism, after doing the test, the treatment duration is for 6 months to 9 months duration. Appropriate monitoring has to be done. Nowadays, government provides this treatment free of cost under an initiative called as DOTS, which is called as a directly observed treatment. The government constantly supplies the medications on a monthly basis and also monitors these patients for development of any side effects because of tuberculosis drugs. If a person develops drug-resistant tuberculosis is tuberculosis which is resistant to normal tuberculosis drugs actually. There are two types of drug-resistant tuberculosis. One is called as a multi-drug resistant tuberculosis and other is called as an extensively drug-resistant tuberculosis. So, depending upon how many drugs the patient is resistant to or the tuberculosis is resistant to, we label them as multi-drug resistance or XDR tuberculosis. So, the treatment duration for multi-drug resistant tuberculosis is prolonged 18 to 24 months, and now currently it includes some injections as well for treatment of tuberculosis. So, multi-drug resistant tuberculosis happens when a person with tuberculosis does not take the medications regularly, or he is skipping some of the medications, or he is taking antibiotics inappropriately. Antibiotics like fluoroquinolone, ciprofloxacin or levofloxacin, if they are taking inappropriately, they can develop drug-resistant tuberculosis. So, drug-resistant tuberculosis is completely a man-made phenomena, and if we take care to take the medications regularly and completely and avoid unnecessary antibiotics, this phenomena of drug-resistant tuberculosis can be avoided and it can be taken care of. So, what are the preventive measures which can take care of to avoid developing tuberculosis? A person should eat well, high protein diet, and the person should sleep for at least 7 to 8 hours a day, and then exercise well and avoid contacts with patients with having tuberculosis. These are a lot of steps which we can take at our level to prevent development of tuberculosis. There is lot of social stigma on patients affected with tuberculosis. There is a lot of discrimination, and these patients are sometimes separated from their families. This is because of misunderstandings about tuberculosis and myths about tuberculosis. Most of them feel that tuberculosis does not have an treatment. The fact is that tuberculosis has got good treatment options both for the treatment of drug sensitive as well as drug resistant tuberculosis. And one more misunderstanding among people is that they feel that tuberculosis spreads by sitting with a person, touching a person, or sharing the utensils with a person. In fact, tuberculosis does not share with touching a person or staying with a person or sharing the utensils. Pulmonary tuberculosis spreads by coughing or sneezing through the air droplets, whereas extrapulmonary tuberculosis, when it affects the lymph nodes or the heart or the abdomen or the kidneys or the ureters or the brain, it does not spread. Lot of people and patients keep asking whether a person's tuberculosis spreads to his contacts, their children or so. So it should be remembered that extrapulmonary tuberculosis does not spread at all, whereas in pulmonary tuberculosis, when a person is having an active disease, that is in the first 1 or 2 months of the disease can spread through the air. So it is in this 2 months of duration that the patient needs to take active precautions, and they should follow proper cough etiquette and sneezing etiquette. So they should cough onto an tissue paper or kerchief, or they can cough onto the arm sleeve or to the forearm, so that they do not cough into the air. Lot of people think that patients who develop tuberculosis cannot lead a normal life, they cannot go to work and they cannot marry. The fact is that patients with tuberculosis, once they are treated with the proper medications, they can go on with their normal life, they can marry, and they can pursue their hobbies. And at a community level, all of us should be educated about how tuberculosis spreads, what are the symptoms and what are the signs, so that the stigmas and discrimination which is associated with tuberculosis can be eliminated. So if you encounter any patient with tuberculosis, try to help them. So it needs a lot of commitment from the family, friends and the community, and the willpower from the patient's side to cure tuberculosis. Today, the whole world is faced with the pandemic of COVID-19, and it is anticipated that patients with tuberculosis, if they develop COVID-19, can have a poor outcome and poor results. So, patients with tuberculosis are advised to take adequate precautions to prevent development of COVID-19 and to continue their TB treatment and not to interrupt the TB treatment. Similarly, the health authorities should make sufficient efforts to make sure that TB diagnosis and treatment programs are carried on as before. Patients with tuberculosis as well as other normal people are advised to stay home and take measures to prevent infection with COVID-19. In case you develop any symptoms of cough, sneezing, sore throat or fever, you should report to your nearby doctor and take adequate precautions. And if you are in contact with a patient who is having a COVID-19 infection, get yourself checked for the COVID-19 infection and isolate yourself at home. And this is what the government is telling today to prevent this epidemic from becoming a huge health problem to the nation. And before concluding again, I would like to thank the Indian Women Network of CII for giving me this wonderful opportunity to speak and share my views on tuberculosis. TB हारेगा, देश जीतेगा. जय हिंद.